Lumbar fusion means that we're causing essentially two bones to grow together or fuse together. Analogy I like to use, a lot of people are familiar with a broken arm. When there's two ends of the bone, we line those two ends up and we put a cast on the arm, and because it's not moving and those bones are lined up with time, they grow together. Similarly, in the lumbar spine, we're causing two bones to grow together, but instead of using a cast, oftentimes we'll usually use screws and then rods to connect the screws of the segments we want to grow together or fuse. And oftentimes we'll use some type of bone substrate, oftentimes from somebody's own hip or sometimes cadaver bone or both, to bridge that gap between the two levels so they'll grow together with time. So the question is, well, why do we do that? When there's some type of problem, if we have to remove enough bone that it would lead to instability between those segments, we need to prevent that problem of instability in the future, and that's why we would fuse it. Or if someone's had a fracture of those bones and we need to stabilize the spine, then we would fuse it. So certain problems do really require that lumbar fusion to prevent future neurologic problems. Depends on what they liked and what they did. Fusions do have consequences. If you think of our lumbar spine, it is a mobile. There are multiple bones and there are mobile segments. When you fuse one or more segments together, you take away the mobility there. Yet our body mechanics, we still want to do the same things in bending and twisting and day-to-day activities. So by performing that lumbar fusion, those adjacent segments are going to have more strain on them with every activity we do over days, weeks, months, and years. So there's a higher chance that one of those adjacent segments may wear out. So in younger patients, there's a good chance in their lifetime they may require one or more lumbar fusion surgeries for those adjacent segments.